All right. Thank you, everybody, for joining us this afternoon. My name is Jackie Kramer, and I am with Insurance Office of America. Today, we're going to go over how you would be enrolling for your 2019-2020 open enrollment benefits. But before I jump in there, I just want to explain a couple of things to you so you'll completely understand that this is your one-time opportunity to make any adds, terms, or changes to your benefits with no questions asked. Outside of open enrollment or even new hire enrollment, you must have what's called a qualifying event in order to make any changes. Most commonly, these qualifying events are the birth of a baby or marriage or divorce or adoption, something along those lines that the IRS determines would be valid for you to bring somebody on the plan or take somebody off the plan. There are also qualifying events such as my employer's also has open enrollment, and I want to take myself off of this plan and go on my spouse's employer's plan. You can do that. Anytime there is an offer of group coverage elsewhere, it's usually going to be a qualifying event. So if you ever have any questions about that, just give us a call or ask Julianne, and we'll be happy to direct you down that path. I know we're also enrolling in a new system this year. We're no longer going to be doing any paper applications. So we will be showing you today how to do this from start to finish. In your meeting invite today, we attached two items. One was a handout, which had a high-level summary and deductions for all of the benefits that we're offering, and how to enroll in the Employee Navigator system. So up on your screen, you should see the How to Enroll Employee Navigator document, and it is pretty simple. I'll scroll down a little bit so you can read it. It's a 4-step process. You would just click here or go to this website and then log in. So I'm going to do these steps live. We don't really need to follow along on this piece of paper. Let me pop this screen over here so you can see it. Now, this employee I'm using today is not a current user, so we're going to have to go down here to register as a new user, which most of you will also need to do. You will type in your first name and your last name. The company identifier is super simple for you guys. It's just the word song. And the PIN is going to be your last 4 digits of your Social Security number and your date of birth. Now, see, this is usually an error that happens if we had typed in something incorrectly. So if one of these items did not work, that would be the problem that we're going to experience. And because I wanted to show you a live demo, I didn't get to troubleshoot this prior to coming on the call. But no worries, give me 2 seconds and I will get it up and running. Demo. Here we go. Now that I've registered and I've logged in, this is how my home screen will look, and yours will look very similar as well. Up here at the top, we've got our little song logo, and anytime you're lost in the system, you can click on it and come right back to the same home page. The welcome message says, "Good afternoon, Jackie. Let's grab a cup of coffee and get some work done." So since we're going to be starting our enrollment, this is what we'll be doing today. Outside of open enrollment, this is accessible by you 24 hours a day, 7 days a week. You have shortcuts here where you can view and update your profile, access any of the documents from the document library. You can even look at your benefits and see what you've enrolled in, or if we had a qualifying event, we could adjust our coverage right here. There's also some important contacts for your benefits, as well as some compliance documents and quick links available at your disposal. But let's just dive right in. For open enrollment, we're going to need to verify our personal information and our dependents information if we have anybody we're enrolling with us, and just get through all of these benefits and sign. That's our three-step process. Getting started, we want to make sure that all of our details are correct here. And if we didn't provide an email address or a phone number, which I believe all of you do have it already, you would need to complete it here. If you hit save and continue, it will let me through because I've got a little more access. And then you'll also need to complete an address here. This address will be verified with the United States Postal Service. When you're done with your address, hit save and continue. Oh, okay, fine, I'll put one in there. And it pops up the verify address, and you can double check that this is correct and use the recommended address. If you have dependents, you can just click add a dependent and put them in here. I've already got a baby demo in here, so we'll just continue on. Actually, let me show you real quick. Add a dependent. If you hit save, it'll tell you exactly which fields you need. So this is required, that's required, your relationship is required, all of that detail. Moving on to step 3 of 10, you can see our little bar is getting a little more green as we go through, and it's going to count down or count up for us. This first page is going to be your medical page. If it's just you, you'll already be clicked as yourself. If you're adding somebody, you would click them, and then your rates will change down below. If you want to see all of the benefits and the rates, I always recommend looking at the compare or the details. Since we only have one plan here, either one will work. Details will have more details on this one plan. The compare will look at last year's plan that you've enrolled in, because we do have last year's data as well, and then compare it to the current plan. Fortunately for you guys, we have very few slight changes to the plan this year, because we were renewed onto a new plan with Blue Cross Blue Shield of Georgia. But we try to keep the benefits as rich as possible. Let me go into the compare to kind of give you that idea. Oh, that's right, this employee does not have a current plan. If you had a current plan, it would be green, and it would be on the left-hand side. And then this is the new plan that we're moving to. So it has the per pay period cost in here. It also has the deductible is 0, just like last year's plan. You have a $2,000 maximum out of pocket and 0% coinsurance. So we'll talk about what deductible, coinsurance, and max out of pocket really mean. But let's scroll down a little bit. Our primary and our specialists are just copays. Something new this year that we didn't have before is if you utilize the virtual visits, you will have no copay for the first 12 visits under the virtual visit platform. Now that is pretty neat, because if you're sick and you just don't want to get out of bed, you can talk to somebody on your FaceTime on your phone or on their app really, and they can check your throat and have you help them with fever and what you feel like. They might even have you go and look at things in the mirror and describe it to them if it was a rash or your tonsils or the problem, and then they'll be able to direct you with what your plan of attack would be to solve this ailment, whether they call in a prescription for you or send it over to your pharmacy, or tell you that you might need some additional services by somebody else. At least you'll know before you get out of bed. Now, after your first 12 visits, it's $15 per visit after that. I don't know anybody that's gone over more than 2 or 3 visits, so 12 visits is amazing. This plan doesn't require any referrals for specialists, and we have a lot of other copays here, so it's a very rich plan. Your lab work at independent facilities is going to be no cost to you. Your x-rays will be $500. Now, if that ends up being less, they're not going to overcharge you for those x-rays. Keep that in mind. Your advanced imaging is $150. Urgent care is $100. And then we get to the inpatient, the outpatient hospitalization. It's basically $500 per day. Outpatient, you're only in there for one day, but the inpatient is going to have a $2,000 maximum on that copay. And you also have emergency room visits. So it's very hard to see anything here that says deductible or coinsurance, right? Because everything is zero. All of those copays are going to chip away at your maximum out-of-pocket. Under the individual side, it's $2,000. So every time you pay a copay, it's going to chip away at this $2,000. And once you hit that $2,000, it is no longer going to be a cost to you, okay? That's kind of like your safety net. Now, out-of-network is a little different. It will be subject to a deductible, which means you're paying the full out-of-network cost, chipping away at this $2,000. When you meet that deductible, you will pay 30% of the remaining balance of whatever those invoices are until you hit your $7,200 out-of-pocket maximum. So it's a completely separate bucket of money. However, also keep in mind that out-of-network services are out-of-network for a reason. Those doctors don't go by the carrier's rules of what they can and cannot charge. However, if the carrier deems that this is unreasonable, they're not going to pay it. So if you have a doctor that wants $5,000 an hour for their work, clearly that's unreasonable. So you may have to pay more out of your pocket on top of the max out of pocket if you go out of network. Now, one of the best things to do is to make sure you're always going in network to make sure you get the most bang for your buck.
Jackie, do you mind if I ask a question?
Of course not. Go ahead.
I just wanted to confirm what you said about the copays. So copays would go towards your out-of-pocket maximum. I guess I'm just used to coinsurance going towards the out-of-pocket maximum and not the copays. But for our plan, the copays would go towards your out-of-pocket maximum?
Correct. Your out-of-pocket maximum will include all of the out-of-pocket costs. Mm-hmm. So you are covered.
Awesome. Thank you.
Yep, no problem. Good question. All right, so down here at the bottom, underneath out-of-network services, we also have our tiered prescription copays. You have 4 tiers, which means, you've got the generics and preferred and non-preferred and all of these brand names covered. It just depends on how expensive they are under the formulary as to what tier they do fall into. And the nice part is if you do have some routine medications that you're able to get under the mail order, you get a 90-day supply for a discount. So instead of paying $15 for 3 months, you're paying $13. Instead of $45 for Tier 2, you're paying $38. So if that's something you're able to do, it would be recommended that you submit for mail order. And we can help you with those too. Any questions on your medical plan? Now, fortunately for all of you, this plan is covered by your employer at no cost to you. So all of you, unless you have coverage elsewhere, should be selecting this plan at least for yourself. And then if you have any questions along the way, please let me know. We also have on the right-hand side your selections. So it'll show you what you were paying last year and what the plan name was last year. We also have helpful resources. So if you need to look up your providers, you can click here and it will open up in a new tab. We have the full handout, we have the full summary, we have your compliance packet, and we have the Live Health Online member flyer so you can help get to those virtual visits. If we hit save and continue, we'll go right to, oh, it didn't like that. I do have 2 browsers open, so let me close one and try to redo it. You know, it doesn't matter how many times you test this thing, when you go live, that's when the glitches happen. All right, we were on medical. Let me get back to that step. All right, so under the medical, we selected that plan, and we're going to save and continue to the next page. This is your dental plan. So under here, again, you can either choose yourself or your dependent, and the rate will change. You can see that it's effective and how we're enrolling, and you can enroll it, or you can actually scroll all the way down at the bottom and say, I don't want this benefit. Baby's too young for dental, so we're just going to take her away. Again, here, we can look at the details. This is the plan and the phone number for principal if you need it. It's also on your home page. We have a $50 in-network deductible on the individual side and a $150 deductible on family. Now, those deductibles only come into play when you have basic or major services. Your preventive, it will be completely waived. Your preventive under medical and the dental will always be covered at no cost to you. So keep that in mind, especially if you're on the plan now. If you've not done your wellness checkups, you should have those done as soon as possible, just to make sure that everything's working right and your blood work comes back as normal. Now, with this plan, you do have an annual maximum of $1,500. What this means is when the insurance carrier is done paying out $1,500 on a calendar year basis for your dental work, they will no longer pay anything else. A lot of times you will still get a small discount, but that's going to be quite a few, maybe like 2 or 3 crowns and stuff like that to get to the $1,500 mark. But because it is calendar year, don't forget, come January 1st, you get that $1,500 right back. Down here we have the monthly cost or the pay period deduction to kind of help you with that. And then there's some eligibility information at the bottom, shows you what your dependents can be on the plan until. And then these resources, which are also on the right-hand side. So you can find a dentist right here, look at the handout again, or the full dental benefit summary. Any questions about your dental insurance? Now, dental insurance does have out-of-network coverage, but it's going to kind of cost you more. So if you go to an out-of-network dentist and he wants $200 for that cleaning, but principal only pays him $100, they're going to do what's called balance bill you for the other $100. So make sure that you're using the network to get the most bang for your buck. Now, I decided I don't want my dental, just to show you what needs to be done when you're waiving. So now it's going to ask me for a reason for a decline. Is it the cost? Can't be because it's free, right? So usually if it's free, you're either going to have to be covered under another plan or TRICARE. Otherwise, you guys should all be taking advantage of the freebies and the preventive screenings. Now we've moved on to vision. Again, I have my baby demo. If I click here, the rate changed. If I unclick, it goes right back down to no cost. I can compare or look at the details on here, and you can see the cost of the plan and the benefits. So our in-network services are going to allow us a $10 exam every 12 months. Our frames are going to be a rolling 24 months, but I'll have a $150 allowance. So if I walk in and the frames I like on the wall are, $100 or something along those lines, I'll get the frames for free. And if I'm getting these types of lenses, it would be a $25 copay. Unless you're like me and you always upsell yourself and you get some of those fancier lenses, there are some lens discounts and copays available. And I always suggest that you just ask the person behind the counter at your vision care provider to help you with that pricing structure. They'll call principal directly, and actually it's VSP through the principal relationship. So they'll call VSP directly and get the data needed to make sure that you're making an informed decision. Also, if you wear elective contacts and glasses like I do, you can get contacts every year, but in lieu of your full glasses or frames. So you get a $150 allowance for contacts, and there will be a copay for your exam. Now, I've only come across medically necessary contact lenses like once doing this in the past dozen or so years. But if you are one of those people that have medically necessary contact lenses, it's just a simple materials copay. There are out-of-network services. However, you have to pay for it up front and submit a claim, and then you can get up to these amounts back on the services that you went out of network for. So again, the most bang for your buck is going to be in network. Any question on your VSP vision plan? All right. We'll select this since I am blind as a bat and save and continue. We're almost there, guys. Step 6 of 10. So now we're on to the life insurance. So this is telling me that I have $32,000 worth of life insurance. For me, it's 1 times my annual salary, and that my employer pays it. It's no cost to me. So all it's going to ask me to do is to acknowledge this page by hitting save and continue. And now we're going to have to provide a beneficiary. This is required, especially since it's definitely recommended that you update them every year. How many times have I gotten a call from, a widowed wife that didn't get the insurance money because he never updated it from the ex-wife? So make sure that that doesn't happen to you. Your primary beneficiaries can be changed on the system anytime throughout the year. During this step, you would just add a beneficiary here. And if you do have a dependent, you can click it from the drop-down, or you can add a new person or an entity. An entity would be more like the trust of Jacqueline Demo. So you're probably more like me, where you just have a couple of people that would be your beneficiary. And again, my trick always is to hit save at the bottom to see what's actually required. So it wants a relationship. None of this is required, but I always recommend putting as much information in here as possible, because how will we be able to contact your beneficiary if you don't give us at least a phone number or an address so we can do that? All right, and we will put that in there and hit save. So now I've got one primary beneficiary in here, but I also have a space for a contingent beneficiary. A contingent beneficiary is what if something happens to Teresa and me at the same time. So maybe we're on a vacation together and the plane goes down. Heaven forbid, I know it's terrible to think about, but if something happens to her, the contingent will step up and be the next in line. So you can put multiple people here with different pieces of this 100%, or you can add a contingent beneficiary that if something happens to your primary, then you've got a backup person. You only need one primary, and as long as this is 100%, you can hit continue and move on to the next page. This is voluntary life insurance. So since you are not new hires, there isn't a guaranteed issue amount. So this button is here, but it's just going to reset back down to 0. Now, if you have life insurance already, it will already be set at what you have, and you can confirm that by over here on this right-hand side. It'll tell you what your current is. This demo doesn't have anything on file, and she hasn't elected yet. This box, just pretend it's not here. You don't have access to that box. So say I want some life insurance, and I'm not going to have what's called a guaranteed issue. I can pick an amount, and if I want $40,000, it's going to be $3.80 per paycheck. That's pretty cheap, so maybe that's a good number for me. But I also have a baby. We don't like to think about it, but let me get the max for my baby, which is $10,000. It's only 92 cents. If I had 10 kids, it would still only be 92 cents. The way it works is that you get $10,000 for each child that you have for this one low cost per paycheck. Now, you can see that everything's in red here, 40,000 pending review of health history. So I will need to complete what's called an evidence of insurability form. When I hit save and continue, it should tell me that on the next page. So it's telling us, yes, you need to complete an evidence of insurability form. Here is the form. So if I click on this, I can save it or print it for later. All right, it's only 3 pages and it's a lot of words, so it's really not that intense. Your information would go into this box. And then on page 2, you have to answer these questions, just little check boxes. And if you have any yeses in a certain area, you'll have to complete this area as well. And then the last page is signing. Okay, so it's a pretty simple form. All you'd have to do is get that back to Julian or myself, and we'll be able to get it over to principal for you. The benefits are going to pend in this system until it's approved. So what happens is the carrier is going to send you a letter, and the carrier is going to send your employer a letter. And then we will update the system with that information, and then you'll see it approved in here as well. As long as we click on that, we can continue. And it's going to want a voluntary life beneficiary. So keep that in mind. Your employer paid life and your voluntary life do not have to be the same beneficiary. But for sake of time, we'll just copy our existing person and put in the allocations already there, so we're done. Makes it pretty quick and easy. Next is going to be our short-term disability. This is actually paid by our employer, but it's going to stop here to let us know if we are out on short-term disability, we're going to get paid $360 a week. So the way that short-term disability works is if I am out due to a sickness or an illness for myself, this is going to kind of ensure my paycheck. So I will have a 7-day elimination period, which means after, on that first week that you're sick or you're injured and you can't be at work, you will submit pay time off of some sort to get through that first week, and then your disability will kick in on the 8th day. Our benefit covers 60% of your pre-disability earnings, up to $700 a week. So to give you a good example of what that means, your take-home pay right now is somewhere between 68 and 72% of what your total amount is. So that's after your taxes and after your benefits. You're only taking home 68 to 72% of the total amount. So 60% isn't much lower than that. You're not going to be able to afford a fancy steak dinner, but you'll be able to go out and pay your bills, get to and from your doctor's appointments, put gas in your car. All those kinds of things will help you along the way. So this employee is going to get $360 every week, and the benefit maximum duration is going to be 25 weeks. So this is a pretty long short-term disability program. Now, since it's free, all I have to do on this page is click this from the drop-down, and you can see that my cost per paycheck is nothing. And then I hit save and continue. Now we've actually made it to the very last step, our enrollment summary. At this point, you can print it by clicking this button. It'll open up, and you can see all of your benefits side by side. And I like this because it's a good record of what you've enrolled in. Okay. If you don't want to print it now, you can always come back another time. but I highly recommend that you review everything. Here's my medical, here's the plan, no cost. Here's my vision, no cost. Here's my life insurance, no cost. Here's my voluntary life insurance. Now it says no cost here, but at the next one, you can see there's a pending. So once it's approved, it'll be $3.80. And once my child's is approved, it'll be 92 cents. Short-term disability, again, no cost. So right now, my total cost per pay period is nothing. And once my evidence of insurability form goes through, we'll have about $4.70-something. I also have dependents down here and my decline coverage. So it's kind of an all-in-one. And if I'm ready, I can go right back up to the top and click here to sign it. And as long as you get this green check mark, you know that you're done with open enrollment. Are there any questions about the walkthrough of the demo?
This is fantastic. Thank you so much.
So helpful.
Yeah, incredibly helpful. My only question is if you can go through, say you had a dependent this year and you would like to take them off coverage for 2019, could you show us how to do that?
Oh, yeah, actually. Let me just pop right back in to my medical, and it's like that. So all you'd have to do is click or unclick. So let's save and continue real quick, and I'll go back. So under my medical, now it shows that I have a dependent. If I didn't want my dependent, unclick, employee only. Click it, employee plus child. So it's that simple. Just make sure that you save and continue. And now that I've gone back and made a change, I do need to go back down to the enrollment summary. See how I've got this little yellow marker instead of green check marks? Because I've made a change and I haven't accepted that change. So if you go through everything and you click the end, but you make a change, you have to do the clicking the end one more time. So it says my signature is required. I have to click to sign one more time. And now it's been submitted a second time with the changes that I've just made. So if you're unsure when you get to the end, just don't click it and wait until you're 100% positive. Now, we are keeping this system open until Monday at midnight. So you can come in here anytime over the next week and look through the benefits. That way, if you need to go home to be with your significant other, to review that with them, you've got this access anywhere you go. As long as you go to IOA, here it is, IOAEmployeeNavigator.com, you'll be able to access our portal anywhere you go. Or you can always bring this form with you at home and be able to go through the steps. We've also put a little blurb at the bottom to show you that everybody needs to come into the system, whether you are enrolling or waiving, in order to make the selection. And we also want you to make sure that you've updated your insurance beneficiary, your emergency contacts, check that your socials are correct, and your personal information is correct. Because remember, I built this with the data that I had. What if I made a typo? So we definitely want to make sure that you've looked at it. You can go right back to your home, and you can look at your profile right here. Here's all the information that we've stored on you. Here's my emergency contacts. I can edit that and add somebody in there. Phone numbers, email addresses. This is kind of your way to communicate to your employer. So anything that you want to put in here so they know that it's correct and updated is perfectly fine. You can use it the way that you need to. Also, if you go to the Benefits tab, that's where we're going to find your life beneficiaries. It may not let me change. Oh, it will. Okay. I wasn't sure if it would let me change it here because we are in open enrollment. But yeah, anytime throughout the year, you can just come right here and update your beneficiaries for the regular life or the voluntary life. Makes it pretty easy. If you click on benefits again, this is that summary. You can see she's not enrolled in any plans, But if you change this from current period to open enrollment, you'll be able to see the open enrollment changes. And you can print it right here. Any questions about this, ladies?
No, it's a really intuitive system. That's really helpful.
Good. And if you have any trouble whatsoever, feel free to give me a call at the office. I'll actually add my contact information to your homepage too, so you'll have it right here. Contacts. Let me make a note. Well, I guess that's all. If there's no other questions, thank you so much for your time and attention today. And again, if you have any questions or you want to take a personal issue offline, you can call me directly at any time, and I'll be happy to help.
Thank you so much, Jackie.
Thank you.
Yeah, thank you. That was great.
You're welcome. I'm going to stop recording.